Hey, we're back. So now we're going to go over the orientation of the body and some of the essential terminology, basically for locating stuff. Hold on. Homeostasis. So much better. Okay, let's get started. Right. So standard anatomical position. So standard anatomical position. And think of somebody who's just standing straight up. And mostly what you want to think of is someone's hands. Like, what are the hands doing? That's the one kind of thing that is the only difficult part of this. So you're standing facing an individual, and the feet are slightly apart, but facing forward. But it's the hands, and what you want to think of with the hands, thumbs pointing out. So hands are out all the way to the sides. I wish I could show you. Can this work? No, that's not helpful at all. We'll show you in the upcoming slides, okay? But the thumbs, just always remember, are pointing away from the body. So directional terms. Directional terms just kind of help us orient different parts of the body to other parts of the body. You would say things like, oh, turn left at the Smiths, or go, west after the yogurt place, right? Whatever it is, it's relative to some other position, some other object. And that's how we kind of think about these directional terms. But instead of using left or right, well, I mean, we do use left or right, but with east or west, we're going to use some other types, which we're going to go over with images coming up. So that's how I want you to think of it. Relative to each other, relative to other body parts, for example. The other thing to know about is the right or the left. So it's always the right and the left to the body that's being viewed, and not to your right or left, not the right or the left of the observer, right? And it's kind of a polite thing to do, right? And it's an accurate thing to do. So here's some of the images from a standard textbook, right? Let me see if I can get my pencil going. Right. Superior, yes. So that's the direction moving away. So if you were to say, oh, hey, that is not a very good arrow, and that's not better. It's an arrow. It's moving away. And think of it as like a car driving down the street. So if a car was driving down the street, and first there was a school, and then after the school there was a fire station, you would say first there's a school, and then further down there's a fire station. So you would say, in this case, first there's the knee, and more superior is the hip, right? And it works opposite for inferior. Another term that you might be seeing is cranial or rostral. Refers to moving superior, or moving actually towards the brain, right, as it curves forward. Caudal, however, caudal is referring to the tail, so that's moving away from the head or down or towards the tail. And believe it or not, when we're talking about legs, from a developmental standpoint, your feet come before, like, the bottom of your butt bone, right there. They're appendages that stick out the side. But since we're dealing with human anatomy, and humans are bipedal organisms, we go ahead and we extend it all the way down to the bottom part of the feet. So that is the most inferior part of the body. Right. Anterior is moving directionally towards the front field of view, or the chest, right? So you would say the sternum and manubrium is anterior to the heart, for example, right? Posterior is moving away to the back. So posterior is referring you would say the spine is posterior to the lungs, for example. Other terms that I want you to pay attention to are the ventral and the dorsal. So ventral, think viscera. That's like what's up front. Your belly is up front. All your viscera and organs are up front. Dorsal, think of like a shark. Like has a dorsal fin on its back, like dun it. It's a dorsal fin. It's probably on the back of the shark. So dorsal is where the back is. Okay, hopefully that helps. Okay. Medial, lateral, and intermediate. So medial, think of it, every human as having like a midline, right? Like right down the center. Oh my gosh, I should try this. Nope, it's not going to let me draw on the video, but I tried for you guys. Okay, so a midline right down the middle. So midline, and it's things that are moving towards the middle of the body. The pain radiated medially, right? So that means it was going towards the inside of the body. Or the pain was radiating lateral, means it was radiating away from the midline of the body, right? So medial going in, lateral going out, okay? And intermediate is like any place that's kind of in between. It's not really moving to or from, or there's not a direction to or from, but it's at an intermediate point, okay? Tensely intermediate. Proximal and distal. Proximal and distal, you know, the thing about humans is we're pretty sure the brain is the smartest organ in the body. And maybe, but kind of also not really. But the thing is we're also very anthropocentric, meaning the world revolves around us humans, and we're pretty sure our big, huge brain is the best thing since sliced bread. So we also use directional terms to refer to things going towards the brain and away from the brain, more distal. So, right. So if something's going towards the origin point, so first off, we're coming from the outside, moving proximal, closer to like a more internal attachment point of the body, right? Going towards essentially where the brain is, and distal being further out, right? So distal would be where your phalanx are, right? Your fingertips. And then something that might be more proximal would be like moving towards your elbow, right? So that's distal and that's proximal. So superficial, surface, body surface, and just so you know, you might have noticed this looks a lot like the figure for intermediate, and believe it or not, on lots of exams, sometimes even it slipped in on mine on a few occasions, you'll see that superficial and intermediate look very similar in what you see in the textbook, but really superficial, think of it the external, like the skin outer type layer, for example, like moving out towards that part. And deep would be something moving in. So if you accidentally stepped on a nail, it would start at the superficial layer of the outside of your skin and stepped on, I guess this is my arm, it's not my foot, but still, it's moving into your skin. So it's going through the epidermis to the dermis, through adipose or fat layer, and then into the muscle, hopefully not to the bone, right? Going from superficial to deep. The body's also divided into two key divisions, the axial and the appendicular. We've invested a lot in some pretty fancy appendages. This, like a lot of things, looks, you know, quite frankly, in anatomy, come from the naming of the skeleton, and we'll get back to this. You'll see this again, especially when we go on to skeleton stuff. Axial skeleton is the center axis point. So that's everything like your head, your neck, and your trunk, right? It's like the torso and your head and neck. Appendages is anything that kind of sticks out on the side, right? So your head, in a way, is an appendage, but it's not. It's really part of the axial body. Just think of appendages as your arms and legs. If you got fingers on it, you got toes on it, you got an appendage. So regional terms are going to talk a little bit more about specific areas within these body divisions. It kind of articulates the point quite clearly, and let me show you on some images. These are some of the words you'll probably, if you're not already working in the medical field now, you will be seeing quite a bit, quite often. This is what I would consider to be flashcard city for some of you guys, so, you know, I'll try to help you the best I can. So cephalic region refers to the fact that inside of your cranium is a bunch of cephalic tissue, right? So cephalopods, those are types of organisms that have like a ton of investment in their brain and nervous structure. So cephalic region refers to the head, essentially. The frontal part is right up here. So this is the frontal bone of the skull, so underneath that. So again, lots of skeleton stuff. Orbitals are where your eyes sit. They sit, if you feel it, it feels like a little circle, right? You can feel that. It's in an orbit, so that's an orbital. Nasal, nose. Nasal congestion, nasal nose. Oral, mouth. Mental, that's a little weird. It means your chin, and here's how you should think about it. You should think about it like this. When people put their hands on their chin, they're having a lot of mental exercises, right? Very mental of them. So hopefully that helps. Cervical is not a cervix, right? That is not anywhere near the human reproductive tract. Cervical, in this instance, refers to the neck, right? So the cervical vertebrae would be right there. Any of you who've had any whiplash know about that. So that's the cervical region of the body. Okay, so continuing down on the axial skeleton is the thoracic region. So the thoracic region and the abdominal region, if you look at, say, an insect, the first segment, body segment outside of the head is the thorax. The secondary one is known as the abdomen. We use the same genes to pattern out our structures as they do in insects. We have those conserved. It's a set of Hox cluster type genes. The thoracic cavity for us has many components, but what you're going to worry about are things like this. Wait, hold on. Let me get the pen. Green? Let's try green. Okay. Sternal cavity right here. Oh, it didn't show up at all. Blue? Yeah, there we go. Sternal cavity right there. That's where your sternum is. It's a bone, quite frankly. And then let's see here. Axillary right here. Mammary is more up in the front. So that's where like the breast would be. So axillary is like kind of coming up through the side, right? Okay. What else we got? Oh, abdominal umbilical. So abdominal has this huge part here, and the reason is because we're going to look at a lot of ways that we subdivide that out. It turns out we pack a lot of organs into it, and so we have some special arrangements when we talk about what's in there. So just generally, abdominal, also referred to as the umbilical region. So the next one would be the pelvic region. So that's the entire pelvis, like the pelvic girdle of the skeleton, which we'll look at. So the hips, essentially, and groin. Inside of the pelvic region is also the inguinal or the groin. So that's where we have penis, vagina, a lot of muscle attachments that you may have pulled over the years if you're in sports. Also, pubic is where the genital region is. So penis and the exterior part of the female anatomy and entry point of vagina. We're going to erase all this because we're moving on to, how about red? Axial skeleton, right? No. What am I talking about? Appendages. Appendicular skeleton. It's late here. I'm so sorry. Okay, so the limbs, the upper limbs and the lower limbs, right? If you got fingers, you got toes, you're dealing with the appendicular skeleton, right? Where the appendages are. So the upper limb, acromial, is right up here at the shoulder. And when we look at the skeleton again, much of this is named for the skeleton. Acromion is a specific landmark of the shoulder blade, right? Brachial, or the arms, right here, and there'll be a lot of that, especially when we talk about the muscles. The human arms are developed specifically for, quite frankly, brachiation. So when you see, like, you know, apes and monkeys swinging from trees, that's brachiation, right? And it's named for that part. So antecubital right here is where you would be doing your blood draws. And antebrachial, right? So it's like opposite of the brachial part of the arm, right? Where your biceps are in the brachial. So antebrachiator is going to be moving the opposite way. So that's on the front part of the forearm. And then I should erase because that's a lot of drawing. And then, yes, in there. And then green. Okay. Next one is manus. And so that's where the hand is, like manual, right? Hand, manual. So we have the palmar is the part of the palm, right? Pollex, that's actually a special name for your thumb. This is pollex. Hello, I'm pollex. Pollex, right? And then digital, like digitales, like your fingers, right? So all these little digits, digitals, right? Okay, let's see. Well, the thing about it is this. When we look at the skeleton, we'll learn that there's, you know, usually one, here we go, like one bone in here, and then two bones in here, right? Two bones in here. This is for all of the limbs. Let's just do it, right? And then there's like many bones, okay? It's kind of part of our developmental patterning. It was how the limbs evolved. So one big one, two little ones, then a bunch of little ones. And it's conserved all the way through fish and stuff like that. So, since they all have similar origin, your arms are related to your legs in this way. Your arms and legs kind of are mirrors of each other. Let's see if I can erase that. There we go. Okay, let's look at that. So coxal, right here is referring actually to the hip, like the hip joint itself. The femoral region is referring to the position of your femur bone, which is that one bone, like the large one bone of your legs. It's a very important bone. We're going to go back to it. It's one of my favorites. I've got a couple favorite bones, and that's one of them. What else? Oh, patellar. So the patellar refers to this teeny tiny little sesamoid bone that gets a lot bigger as we age, and you may know it as the kneecap, right? It's also the patella, or the patellar region in this case. So crural is referring to the leg, this part of the leg, but fibular, right, is referring to one of those two bones. Oh, too many drawings. Hold on, let's just erase. And then, yeah, and then, how about purple? Okay, right, so we have two bones here, one bone, joint, two bones here. And one of those bones is the fibula, so fibular region. Pedal, like biped, right? You got feet, they're peds. That's your foot. On your foot, down here is your tarsal region. That's where your ankle is located. Metatarsals are analogous to what we would say is the metacarpals of the hand. We'll look at that a little bit later. So that's the bones of the foot proper. And then the far ends are the digits. Oh, I'm so sorry. So are the digits, right? And so what else? Oh, your thumb is pollex. So your big toe is hallux. Right, okay. Okay, the posterior. Let's do the posterior. So we still have, some places where we keep our brains, so cephalic. But now we're going to look at something else. So an otoscope, some of you have had ear infections or have kids that have ear infections a lot. So they're going to be looking in the ear, right? So that's otic. That's what that refers to. Occipital, if you take your finger and you just feel on the back of your head, you'll feel like there's kind of this bump, and it happens like right there, a little bump, right? In most animals, tons of big, heavy, crazy neck muscles that hold up their head because their, head isn't sitting on top of their spine, attach at that point, right? It's a muscle attachment point, primarily. It's also known as a nuchal crest or an occipital bud. That's occipital region. It's the back of your head, vision centers, stuff like that are there. Cervical, again, right? Neck, right? Not reproductive anatomy. Placing on purple. And let's go for green. Okay. So this is the best. The back is also known as the back, which is great. That should be easy to remember. But remember also dorsal, right? That's like a dorsal fin of a shark. I'm a scientist, not an artist. Sorry, guys. Dorsal fin, right? Dorsal. Okay, so that's the back. Let's see, let's just erase that so you don't have to look at it more. Okay, vertebral refers to the position of your vertebrae or your vertebral column, right? And scapula, remember those like shoulder blades that you have? They're right here. Scapular, right? And you can actually feel them. They feel like big flat bones because they kind of are those. What else? Lumbar. Folks with back issues know about lumbar. So you say, oh, my lower back hurts. Oh, my lumbar region. Yeah, that's because those particular vertebrae are known as the lumbar vertebrae, right? So that's cervical and then thoracic, and we'll get to those later. And then, of course, like the lumbar, they tend to really suffer from things like stenosis and eventually fusion, those along with a lot of the cervical vertebrae. Sacral is the final. It's like where your tailbone actually is. What is that? Why is that there? Okay. That's where your tailbone is. That's where your tail is housed. At the very end being your coccyx. So those are a few set of vertebrae that are actually pretty wide, and they help connect in your hip bones, keeping your legs locked in place and allowing for movement, but also stability. The glutes refer to the butt cheeks. One of the great things about humans is we have ginormous butt cheeks, and it's probably because of all the things that we're evolved to do, one of the most interesting ones is we're supposed to be long distance runners, not marathon, not sprinters, but like marathoners, like joggers. And I believe most of my classes have attached also a TED Talk a little bit about why it is that we stand on two legs and what we do and some of the amazing things that we've discovered about that since. But the glutes are a pretty significant region in humans. Go ahead, take a look at your cat, take a look at your dog, take a look at an ostrich. I don't care. They probably don't have the glutes or the meat back there that we do because we need them for sustained endurance. All right, so, oops, there it is, highlighter. Let's try yellow. Okay. Perineal. So that's the point between the anus and the genitalia that connects. So it's in both males and females. It's an important part because there's a lot of weight that goes there. So we'll talk a little bit about that and maintaining things like bladder control and like actually human like birth and all kinds of stuff. It's a pretty important region. Can often become injured or distended and is quite painful, needs to be caught early on. All right, so let's go over here. So upper limb, again, acromen, acromal, right up here, the attachment point of the acromen in part of your scapula. So brachial, right, so the top part of the arm for brachiation. And then let's kind of jump down here, like antebrachium, right? So like you have two different ways that your arms are going, so antebrakes. Olecranal actually refers to a part of the morphology in the bones of the elbow. Right? So that's what that is, and we'll look at the skeleton has that a little bit more on. Let's see, manus, right? Manual, hands. The metacarpals, so those are the bones, just like we talked about in the feet, that are underneath the skin, right? So we have the digits that stick out, and then underneath the skin, we have the metacarpals, right? Just like in the feet, oh, it's not on this one, we have the metatarsals are the part that's under the skin all kind of webbed together, and the digits are the parts that are separated out, like the toes, fingers, propers. Okay, so yeah, so digitals. Femoral, right, so femur right here. Popliteal is the back of the knee. Right, so those of you with, my dogs had their cruciate tendons torn, so I always think of the ACL in humans as a cruciate because it is one, but you know, we call it ACL in humans. That's where that meeting point is. That's going to be one of the case studies in most of the anatomy classes I teach. It's not in all of them, but we might see it. Let's see here. Sural is the calf, right? That big gastrocnemius collection in the back that helps us with that endurance running. Fibula, right? Also in this part, and then calcaneal is this bottom part of the heel, actually. So not the ankle, but like the heel, right? Rests on calcaneus. Okay, and I think that's that. Awesome. Let's move on. The planes of the body. You might not have realized this, but you have planes. There are a few, these are kind of the main planes of the body, right? So this first one is sagittal. The second one is coronal, and this third one is a transverse type cut. And so what you would imagine is this like sheet of glass is actually slicing that individual right there. Most of the time, we're using these in terms of imaging, so radiology type stuff, or in terms of pathology, so somebody had a tumor dissected, and so we're going to slice it up in a whole bunch of slices and then look at all the cell types and determine the histology to see if maybe it's cancerous or non-cancerous, or you know what's going on there. So let's go into this a little bit more. Sagittal. Where does it come from? It comes from this thing right up here. This is, let's try green. This is a gorilla skull. It's a sagittal crest. This is a human skull. As you can see, it doesn't have that large outcropping, right? So this sagittal crest is actually a meeting point in apes where we had, we don't really have it, and that's a whole story, where the muscle just like fused in and had to stick on the top of your head and had to anchor onto something. Bones have shape because muscles have to anchor and then they pull on them. So when you see an animal like a gorilla, you think, oh, this must be the most powerful jaws ever, and they're pretty powerful. But moreover, they're so big because they have to chew for like 8 to 10 hours a day, maybe more, just to get enough calories to live, because they're vegetarians. They don't cook their food. They don't eat animal meat. So their calories are like, they just really have to work for them. So they have these huge muscles, right? Humans, we actually all share a mutation, which results in a smaller, teeny tiny set of jaw muscles. It's shaped a huge amount of our evolution, including our requirement for cooked food. in most cases. It also means that we've had a retracted or smaller jaw, and we've generally lost this giant crest. We don't need that giant anchor point. We've lost our ability to use it, so now that sagittal crest is just a sagittal point. It's a sagittal plane. Oh, that was horrible. Here, let me try to erase that bad one. There it is, right down the middle. So that's sagittal proper. Think of a sagittal crest. Now you know the story. So there, that's some human stuff. Coronal plane is referred to as a coronal plane because it's like the corona of the sun. It's the crown. Like here's like the princess. She's got the crown. It sits right here, so it's gonna go right on this horizon type line. And then here's the plane on our model going slicing right down the center of her body as if she was wearing a crown, going straight through. Transverse plane is actually can be anywhere on the body, right? And even oblique, which is, I don't think I have a slide for, so I'm going to just do it here in case, right? Which can be like at an angle, right? That would be an oblique and transverse cut. So, right.